No, I'm getting a lot of, I always get a lot of questions about vaccines, and often parents will ask them, I think just to ask them, and I respect that. It's like when I tell my daughter when she's driving back to college, drive safely. Like if I don't tell her to do that, yeah, she'll still be fine, but I feel like I have to remind, because if I don't, something happens, I'm like, ugh. But I often will get parents will ask me, they're getting the vaccines, the 2-month visit for the first time. The infant may, in our office, will get 3 vaccines, 3 shots and 1 drink, which is something called rotavirus for a really bad gastrointestinal illness, but I won't go into all the the vaccine specifics. But that's like the first time these kids are getting a round of shots, except when they're born. Most infants will get a hepatitis B vaccine when they're in their first day or 2 of birth. But parents, after I give them the spiel around 1 month of what they're going to get, the recommendations, what we're protecting against, the side effects, contraindications, all the stuff, I try to go through it. But usually at that 2-month visit before they're going to get the vaccines, which I don't give in my office nicely, the nurses give them or the medical assistants. I used to do that when I was a resident, but I don't do it anymore. And
you moved up in the world.
Well, one, the nurses, they do it all the time. They're quicker. I'm much more deliberate, slower, and I don't do it all the time. So I'm a little rusty. I can do it. It's not that complicated, but it's also it creates. I think it sustains a little bit of a nice interaction with the infant still. With me, the kid, the 4-year-old, I'm not one giving them the shots. But the parents will often ask me, are the shots safe? Sometimes I'll say, no, they're not, but we're going to give them anyways. But no, and I try to ask I often ask why you're asking the question. What are your concerns? And they'll talk about what they've read online about what could be in the vaccines, bad outcomes, and I try to answer all their questions from a place of empathy, right? Being a parent myself, and I remember when I felt like if I wasn't a pediatrician and I went into my doctor's office for the first our oldest daughter Hannah's doctor's visit for the first time, she got 5 shots at that visit. Now we have more combination shots. She got 5 shots. If I wasn't a pediatrician, I would have been like, "What are you guys doing?
Right?
Is this?"
Right.
Are the vaccines safe? Giving 5 at once safe? Do we have to do this? Is it okay? Why? I mean, when you were in the military, how many shots did you get at once? Of course, you were a grown man.
I got all of them once because I didn't have my immunization record.
It's crazy, exactly. But parents will often ask that question, even now more with the COVID vaccine, right? Is it safe? What would you do? But I'm always answering those questions. And actually, I really don't mind answering the questions. I do mind sometimes, not mind, but when someone says, I've read the data and I've read the research and I don't feel that the vaccines are safe. Because if you really...
So if I'm an anti-vaxxer, right?
Yeah.
And I say, I don't want my kid to get any vaccine, can I still be a patient?
Yes, because my feeling is if you really understood the data, and if we can form a stronger relationship and a trust and communication, that I feel that over time that we could get those vaccines into this child.
But if I don't want it, can I still be a patient?
Haven't usually got to that point because my worry is my main worry is if I say no, you can't be here anymore, they're going to go somewhere else. Yeah. They're not going to get vaccinated. So I can usually, I've got a pretty good track record. I mean, some I'm still working on.
So you don't have one single.
Oh no, I do. I do. I'll be honest. No, I have a few patients. I can list you their names honestly. And I have some families that started vaccinating and backed off with the subsequent children. And I have kids who weren't vaccinated for 8, 10, 11 years, and now they're getting vaccinated, or they're getting vaccinated because they're going into college, or the kids want to get vaccinated. So. Do I have some kids floating around who are partially vaccinated? Yes, not many. Do I have some kids who are floating around who are not vaccinated at all? Yes. I don't expect they're going to stay like that for long. And at some point, we're going to have that conversation. But I just feel I can serve them better. I don't want someone worrying that they're going to come to my office and be exposed to someone who's not vaccinated. They could transmit a disease. That's pretty low. That's a low chance. I mean, the numbers of kids in my office that have no vaccinations. But I just feel it's too easy to me not to have the conversation. It's too easy to not have the conversation, right? Just go somewhere else. I want to work at getting those vaccines. I usually succeed, and if we don't, we figure that out.